Oh, she's blinking.
Yeah, we'll get it anyway, even if she's blinking.
I know.
Before you get there.
Oh, there they go.
Now you've missed her eye. Yeah.
No.
That's okay. You can still see the eye once they put the section
And you'll see
in
the
there.
other one.
Oh, this is why.
Did you snap it, Abby?
No, I'm recording it.
Oh,
And then you
I'm
can
so
take a
sorry.
picture.
Of course. I'm sorry, sweetie.
Okay, so then you'll kind of see the eye get docked up here next to the laser. And this is creating the flap to begin with. This is the first step. And all they're doing here is kind of injecting tiny little gas bubbles under that very top layer of the eye. The eye's a lot like an onion with all the different layers, okay?
Like
So-
your lashes.
Yeah, they didn't get those out of the way there with the section. They're readjusting the suction ring there. We'll put a lid speculum in there to kind of help hold that eye open so she doesn't have to worry about blinking or
Yeah,
anything.
she was worried
She
about
worries
that.
about
Yeah,
that, yeah.
Another little numbing drop.
Whoa. Crazy.
Uh-huh. And is it through that door is where she is? Is that her room?
She's just right
Oh, there.
back
Okay.
here. So she'll come in through this way, through this door.
And what's that she's doing?
It's like he's moving back the membrane, or?
Well, he's just kind of drawing it out, kind of.
Oh, okay.
Yeah, I see there.
Moving things back.
Yeah,
Just
yeah,
kind of
yeah.
clean the area.
And she can't feel a thing, right?
Nope. Her eyes
Oh.
are numb. She may
Okay.
feel a little pressure once he puts this suction ring on, just because it's kind of adhering to the eye
Mhm.
there. But that should be the most that she feels. Okay, so we've got that on now.
Thank
You're welcome. Okay, so there's the eye docked up under the laser.
Is that little metal thing we see the laser?
No, you can't actually see the laser itself.
Has he already done it then?
No.
No.
They're just still trying to get that suction ring situated. It's just keeping it on there.
Looked like a hair piece.
Yeah, it looked like an eyelash gun.
Yeah.
Mm-hmm. And that redness is just from the suction ring kind of going
Yeah.
on and coming back off, so
Yeah.
that'll go away.
Good. I saw that, John. Oh, he's
Uh-huh.
worried about the little blood spot.
No, just kind of like bruising on the eye.
Yeah. Yeah. The blue around the center, that's her blue eyes. If,
Yeah,
if-
that's just the
So, like,
kind of the discoloration of the lens right here of
Oh.
our
is that
microscope.
what's happening now?
That's the lip flap being created. The flap.
So the laser's doing that. Okay.
Well, that's interesting.
Yeah.
See, it sectioned it all.
And now he's kind of pulling it back, right?
Yep, he's just taking the suction ring off.
Uh-huh.
Alright, so now they're just moving her over. They've created the flaps on both eyes.
It moves her.
And then moves her over to the second laser that actually does the vision correction part of it.
Wow.
Okay?
Okay. Now, did they just do one eye right then, and then they go back to the other eye, or
No,
did they do
created
both?
both flaps.
Both
yeah.
flaps. Okay.
Wow.
So both her eyes are like
Didn't
extremely
even see
open.
that. That's
Yeah.
amazing.
I think we kind of came in at the tail end of the very first one, so we might have missed
Oh,
the
okay.
flap being created.
Okay,
Oh,
Yeah.
that's all right.
yeah.
Once Dr. Drake goes in there, he gets in
He
there and
does it.
starts going pretty
Mhm.
fast. So.
Wait, that's good.
Mhm.
He's pretty good at it, so. All right. Alright, we'll go back to this view here. They're going to put some betadine around the eye, kind of wipe it off. And
Oh.
he's just taping the lashes back to get those out of the way. Putting a lid speculum in the eye to help hold it open. And what he'll do here is he'll just use a blunt instrument to kind of go up underneath that flap that was created to peel it back. So then the laser can go directly on top of the cornea to do the vision correction. Okay?
Okay.
So that's what he's doing now. For orientation purposes, this is her forehead down here, so we're looking at it upside
Upside
down.
down.
Okay.
Mhm. So it's still attached here.
Yep. Oop, there
Okay,
it went.
and he just-
Whoa.
Laid it back. And so now these
Oh my
two
gosh.
dots will become one. It'll track down on the pupil, okay? So she can't look in the wrong direction. If it were to move at all, the laser would completely shut down.
Yeah.
Okay? So they'll track down onto the
See
pupil.
if she can see. That whole thing came
Uh-huh.
out. Yeah.
Yeah.
And then once it tracks down, the laser vision correction, then that's the correction happening.
Yeah.
So you can kind of hear and see there.
Wow. That's interesting.
Yes, it
Mhm.
is. Abby, do this for a career.
Yeah.
A lot
She's
of
trying
money.
to make the right decisions.
Yeah.
Yeah. Yeah.
A lot of schooling, but pay
Yeah.
off. Alright, and so they're done with the vision correction.
Oh.
So they'll just lay the flap back over. It kind of acts as its own bandage there.
Okay.
Um,
Oh, there it goes back over. It
Uh-huh.
looks glossy now.
Yep, and he just kind of smooths it out, make sure it's all lined back up with the sides here.
Mm-hmm.
Takes the little putty knife.
Just smooths it down.
That's a mighty little putty knife.
They're very tiny. Putting some cool oxygen around the eye to help adhere it too, and then a
Okay.
thick drop to moisturize it. Okay, since it's been open for a little bit.
Yeah.
So he's done with that eye.
Cool.
Very good.
Uh-huh.
Very good.
And he'll move over and do the same thing on the other eye.
That is so cool when they like
Oh,
open
it
it and peel it
is.
over.
Oh,
That's interesting.
Well, and he
it's
makes it
amazing.
look really simple,
Sure
you
he
know.
Well, Teresa and I were talking that when we each had ours done,
Mhm.
they didn't have the laser to cut
Right.
the flap. It
Right.
was a blade. And so
Right.
my husband was in here
Uh-huh.
watching it,
Yeah,
you know.
right. Yeah, it's a little different now.
But then I reminded her that it was good we did it then because that helped them learn
Mm-hmm.
how to do
How
the
to do
laser
this.
now.
Yeah, absolutely.
Yeah.
So just taping those eyelashes back again.
Hi, Bree.
Now put the lid speculum in there to help hold the eye open.
Very good. She's gonna be like, oh my god, it's my eyeball.
Yeah. So I was going to ask earlier, I can see blue pigment. Of course, I realize some of it is. But if Abby now here, who has green eyes,
Mhm.
where I see the blue
Mhm.
would be her green, probably,
Yeah,
right?
yeah, absolutely.
There it
There
goes.
goes that. Down the flap.
Yep.
Loosened
I'll just
it.
pull it back.
Laid it back.
Yep.
Oh, it's sticking.
Now the laser like does a perfect circle and then it does it, or did he
Mhm.
cut that?
Yeah,
Like-
no, the laser does that.
That's
Yep,
nice.
all
And see,
Okay.
with me, he did it with the he did it
Right.
himself with the blade.
Ooh.
Right.
Yeah.
Okay, so they're doing the vision correction now.
Yeah, that's kind of a hard.
And this will last her until,
Mhm.
most likely, until
Yeah.
she's 40 and
Well,
gets the old age.
Right,
Or
yeah.
long arms.
Yeah, long age old, yep,
Yep.
absolutely.
There it is. See how
Okay,
it's
so they're
not-
done with the vision correction. They'll lay this flap back down and smooth it out, just like the other one.
Woo.
And then once she's done, I'll bring her in here and we'll go over all the post-op instructions
Okay,
together, kind of the do's and don'ts and all the medications. So I'll put some cool oxygen down. Here in a second, just kind of smoothing out those edges. There's the oxygen. He'll put another thick drop in there, take the lid speculum out, and she's done. Alright?
Right.
Wow.
So I will go and get her, and I'll bring her in here, and
Wow.
we'll go over everything.